Okay, so Dr. Amber, thank you so much for joining us today. I reached out to you because, well, first of all, I love the work that you do, and you have helped me before with cesarean section and scar maintenance and pelvic floor care with clients that we had. And I have a video on TikTok that has gotten a lot of attention, but the attention that it's gotten is people telling me how much they're hurting because of pubic symphysis pain. So thank you so much for coming so that we could talk about pubic symphysis pain and have an expert in this area to help the people who are still really hurting. And
Yeah,
do you want to say a few things about like what you do and your
sure.
business? Okay.
Yeah, thank you, Lori, for inviting
Yeah.
me on. I love talking about all things pelvic health and pregnancy and postpartum, so I totally love doing these types of talks. But what I do, I'm a doctor of physical therapy. I specialize in pelvic health and spine care, and I work a lot with pregnancy and postpartum symptoms. I do some work with women to prepare their bodies for birth, and obviously working with women after having birth to manage recovery. And pubic symphysis pain, I hear a lot. So, both in my pregnant population as well as my postpartum population, and sometimes in people who aren't pregnant or newly postpartum too. So, it can really affect a wide range of people, even outside of pregnancy and postpartum. So, this I think is a great talk.
So I'm going to pull up some of the questions that people have sent us, and we could just go through a couple.
Perfect.
Okay, cool. So that you'll notice some themes in here. Um, there are several people who say they're not pregnant, but they're having pubic symphysis pain. And I had a friend who fell down and sprained her pubic symphysis. So I know that can happen. So what would you say to these folks?
Well, I would say that, that can happen for sure, like you said. And a lot of times people feel like, oh, well, this can't be it because I'm not pregnant. But rest assured, pubic symphysis pain can definitely happen in other stages of life. And there's a lot we can do to try to stabilize it and manage it so it doesn't become a chronic issue.
Just had my baby on the 18th, and my pubic bone feels like a loose tooth getting in the way anytime I try to move.
Yeah, that sounds like she's got quite a bit of what we call instability at that pubic symphysis. She's newly postpartum. I'm assuming that's the 18th of this month, which was just a week or so ago. So those first couple of weeks, your hormones are going from being extremely high and then crashing really hard. And so your body has a lot of adjustments that go through that phase. And with your tummy muscles being stretched out and your pelvic floor possibly being stretched out if you had a vaginal birth, then those muscles are so loose that it can't stabilize that pubic symphysis very well. And so this is something that can definitely happen. Maybe she didn't feel this right away when she was pregnant, but now that she's postpartum and her muscles are so stretched out and there's not a big, fetus in there taking up some of the fascial tension, then it
Mm.
can feel a lot more loosey-goosey once baby is out.
So can you think of like an exercise? The exercise she's referencing right now is like the pubic symphysis adjustment, like the little snap. But can you think of
Mhm.
something that somebody could try to tone those muscles back up or to give them some stability?
Yeah, I think the best way, especially this early postpartum, is I would really love people to start engaging their deep abdominal muscles. And so, one of my favorite go-tos this early in the postpartum phase is to get on hands and knees and work on just pulling in the belly button towards the spine. And so, when you're on your hands and knees, your belly will sag, gravity will pull your belly down, and your job is then to exhale and lift the belly back up. And that can start getting that deep stabilization system to control the pubic symphysis. Um, and that will help with that loose tooth sensation. And if she can start to get that muscle engaged, then she can start to preemptively engage that muscle when she's going to be doing bending, lifting, twisting, things like that to try to stabilize it. And so it doesn't feel like it's going to come out of place or pop or things like that.
So I know somebody will ask, how often would you do that and for how long?
Yeah, so typically my go-to starting phase is to do about 10 to 15 repetitions, probably 3 to 4 times a day. So not a crazy amount. What we're trying to do is wake up these muscles, and we want to think about when you first start, we want to always initiate with a belly breath. So you're going to inhale and have your belly sag down, and then you're going to exhale and pull up. And I usually have you just have a long inhale and a long exhale as your parameters of how long to hold and things like that. The biggest thing, though, with that exercise is making sure that when you're lifting your belly up, that you're not arching your back as well. You got to keep your back flat and just lift with the abdominal muscles instead of like arching your back up. And that will really help get that deep stabilization. And then you can start to add in hold time. You can start adding in a leg movement. You can add an arm movement as you feel like that abdominal muscle is engaging better and you're holding better.
So then this next person says that day one of her period is absolutely killing her.
Mhm.
And she's a year and a half postpartum.
Yeah, so that really indicates that she's got some hormone fluctuations that are possibly playing into it with her menstruation. Um, so that could be part of it. Maybe she needs some hormone balancing, but also part of it is that when we're on our period, our uterus does swell a bit, and that can create more pressure and change the way the uterus is sitting. So sometimes it can put a little bit more pressure on the pubic symphysis. And if she's having any bloating during her period, which can be so common, that bloating through the abdominal cavity can actually shut off your core muscles a bit, and that can make it harder to get the core stabilization for the pubic symphysis.
So would that be the same exercise for this to try to create more stabilization?
Well, yes and no. Definitely wouldn't hurt to do the hands and knees belly lift, but probably what would be more helpful for her is just try to control the bloating and swelling. So I like to do some gentle myofascial massage to the lower belly. And basically, you just like take your fingers and do some gentle stroking kind of up from the pubic bone up towards your head and try to get some of the fluid moving so it's not so heavy in that area.
I hope these people have a pelvic floor therapist near them, by the way. It's
Yeah,
so
we do.
valuable, so valuable. Can I have this in 8 weeks pregnancy? So she's just pregnant and it hurts and she feels bloated, which you just brought up, which is interesting.
Mhm.
And I don't know if this could
Yeah.
affect like bowel movements and stuff or urination.
Absolutely. Yeah. 8 weeks. I mean, usually we see more pubic symphysis pain later on in pregnancy, but it can definitely happen early on. Usually in that first handful of weeks is when relaxin actually spikes the highest. So sometimes you get some initial loosey-goosey stuff going on because of that spike in the first trimester with relaxin. But you also have with those hormones really starting to have the roller coaster ride through pregnancy, you can have a ton of constipation, like you mentioned. And that constipation can cause more bloating and swelling in that area, more heaviness. And that can cause a lot of dysfunction with the deep stabilizing muscles to engage appropriately. Um, and so that could be a lot of it. And plus, if she's 8 weeks pregnant, if she's having a lot of the nausea and vomiting and the typical morning sickness, that can create a lot of problems too, because then her abdominal muscles might get too tight, and then it could start pulling on the pubic symphysis more on one side than the other, potentially causing more of a shearing force or more compression through there if she's having a lot of nausea and vomiting.
Uh, and what would one do for that?
If that's the case of you're having a lot of the nausea and vomiting and your abdominals are getting really tight because of that, that's where doing some diaphragmatic breathing, belly breathing, things like that can be so valuable to try to relax that area. Some gentle mobility like cat-cow and open book stretches and things like that can be really wonderful to try to decrease any tension that could be there. If it's constipation, then there's a whole slew of things we can do for constipation management with some belly massaging, obviously water intake, the squatty potty, pooping mechanics, all that fun stuff.
Okay. Now she says she goes to the toilet often. So I don't know if that is urination or pooping.
Right.
So,
It could be either one. I
okay.
would venture to guess maybe urination is the most common that I see this early on.
Okay.
So if she's having a lot of increase in frequency with urination, that can definitely be a problem. That could indicate potentially she is having a lot of overactivity in her pelvic floor, that she's not fully emptying her bladder well enough at each toilet visit. Or potentially she is, getting some of the hormone changes that are impacting the bladder, and we need to do a little bit of bladder retraining to make sure she's not having constant frequency throughout her pregnancy. Because all those things are things that will likely get worse during your pregnancy if you don't try to nip it in the bud early.
Okay. Okay. And this next person, what about pain on the right side of the pubic symphysis? I assume she's saying, I have a sharp pain that's happening towards the right side. It started last night, and she's only 4 or 5 weeks pregnant.
Okay, yeah. So if it's just off to the side of the pubic bone, it could be a lot of different things potentially. 4 to 5 weeks-ish is super early. So, we always are concerned about how well that egg is implanting into the uterus. Sometimes you get a little bit of some spotting and cramping with that. So maybe that could be partially part of it, is just the egg implanting causing some cramping. But you also have your hip flexors that run in kind of that area. And sometimes that area gets really tight in the hip flexors, especially if you have a sitting job or things like that. And sometimes that can kind of mimic that right-sided pubic pain. Um, and as well from the bottom up, we have a lot of your inner thigh muscles attaching to that area. So sometimes if those are really tight, then it can cause more pain on more to the side.
Now, this is the most common question, which is like all these women, one after another. She has a 2-year-old. She's having it. This person is just 2 weeks postpartum. Somebody else has got a 3-year-old, and two more people who have said they're still
Yeah.
having pain. They're still having pain, and they're afraid because it hurts so much to even have another baby.
Yeah, I mean, well, the first thing is just realizing obviously they're not alone,
Yeah.
that a lot of women go through this. And although it can be a common thing that lingers, it's not normal. And it's definitely something that needs to be addressed as soon as possible. And I can understand the fear of having a second baby because if you're already still in pain from the first, you're like, oh my gosh, what's going to happen if I go through this again? So I totally understand where these women are coming from. The biggest thing is if it's lingering for a long time, there is something pathological going on in your body, meaning that your body is not either having good alignment and or mobility through the hips, the spine, the pelvis, and or you're having some major weakness in your core stabilizing system. The only way to really know what it is to go in and get a pelvic health evaluation, because there are so many different categories of what could be causing lingering pubic pain after you've had a baby after several years. So the number one thing is go get evaluated. But we need to be able to see, is your pelvis sitting in good alignment or is it constantly sitting twisted? Is one side having overdominance of one muscle that's pulling on the pelvis and causing pain? Is your core stabilizing system not strong enough and too weak and it's not getting the support it needs? Or are you having overactivity and everything is still too tight? Because very common after you have a baby, especially a vaginal birth, you can have a lot of tension in your pelvic floor that just hangs out there for a long time. And that tension can pull on the pubic symphysis and cause a lot of pain in that area. So the hard part is not having a specific way to say, okay, you're having long-standing pain, do this exercise or two, and that'll cure it. Is we don't know which exercise is most appropriate until we've done the assessment. If you're trying to look for a pelvic health PT, I always recommend going to the APTA website and you can search for a therapist near you and you can filter for pelvic health. Um, And so that's usually the best place I like people to go look for their PT in their area. But yeah, it can really vary a lot on if you have somebody, especially if you live in a rural area, probably less likely you're going to have somebody close
Okay.
by.
And Portia was kind of part of all of that, but she was talking about how she is so debilitated at this point that she can barely move. Does that sound like it's still possibly just pubic symphysis still?
Well, it could be that she's starting to actually have some true dislocation of the pubic symphysis. It is rare, but it does happen in some patients where you actually truly get too wide of a gap and then they dislocate. So if she's having that severe of pain, I definitely recommend going straight away to your OB or midwife or potentially even urgent care to do some imaging to see if it truly is dislocated. Because if that's the case, there's a whole lot that they need to do differently if it's truly to that extent. But if it's just like I'm having some severe pain, and they do imaging and it's not dislocated, it could just be that she really needs to work on that stability and motor control. So when she's getting in and out of bed, when she's, walking down the street, that the muscles are supporting her better, and potentially using some external support like a belt.
Would it be safe exercise to relieve pain while on pelvic rest? Some of the pelvic snaps.
Yeah. If you're on pelvic rest, that basically just means nothing goes in. And so you are really free to do most all exercises that don't include anything being inserted. So this should not be a problem to do these exercises if you're just on pelvic rest. If you're on bed rest, that's a different story. But pelvic rest, you should be safe to do these things. But I would always, if you're having questions or concerns, like I'm not sure, talk to your OB.
Okay. And then the last question, which by the way, thank you. I didn't even know what pelvic rest was. Now I do. Okay. When I cough, I feel my pelvis open up a little bit. Sometimes it's really weird.
Yeah, so that could be, when she's talking about the pelvis opening up, is she talking about like feeling like the actual like pubic symphysis separates, or is she talking about like bulging in the pelvic floor? I can see it being potentially either or. Um, but coughing is a ton of abdominal pressure. And so whenever we cough, there's an extreme amount of pressure that gets pushed down. And so that can definitely create a lot of strain on an already kind of loose pubic symphysis, as well as if the pelvic floor is not strong to stabilize against it, then you're getting all that force down on your pelvic floor really quickly. And that can be a lot of extra stress and pulling and tension through that. And that could be pretty uncomfortable. And then obviously that could be when we're getting some leakage and things like that, which would be not good and definitely something to look at treating.
And would you mind just showing us real quick, pelvic symphysis? I thought I saw you pulling your model over a moment ago. So
Yeah,
just so everybody's
I'll show
really
you.
clear on what we're talking about.
Absolutely. So this is the bony model without the muscles. This little part here, this jelly part in the middle, that's a little bit of a disc that sits between these two pubic bones. And so this whole area through here is the pubic symphysis, and this is the front side, obviously. So you're going to be feeling this really down low in the belly region. Sometimes you'll even feel it a little bit towards the crotch, and towards the clitoris and labia a little bit as well. Because if I'll show you the one with the pelvic floor muscles on attached to it specifically, so you can see all your pelvic floor muscles come and attach in or around the pubic symphysis area. This is the vaginal opening here. This is your clitoris. So you can see that all this comes and attaches in that region. And this is what we're talking about as part of your core stabilization is this pelvic floor, as well as your abdominal muscles coming down this way. And then your inner thigh muscles come and attach through here as well. And so all these different muscles can pull on it and start to create some of the tension or twisting and things like that. And during pregnancy, naturally, it's going to start to separate a little bit. And that's very normal. We need that in order for baby to come out. We need it to
Mhm.
separate a little bit. But for some women, especially if you are already a hypermobile or very loosey-goosey person, then that separation can get even bigger, and that can be more painful and more problematic.
So what would dislocation of your pubic symphysis look like?
So pubic symphysis dislocation would mean that it is really stretched out. And so I
Okay.
think that if I remember right, it's somewhere between 8 to 10 millimeters of separation between the two bony surfaces. Anything less than that is normal, but anything more than that is a dislocation, meaning that they've separated way too far. And then obviously you can see that would be not good. These guys
Yes.
would really start to move way too much and put a lot of strain and tension on everything that attaches in that area.
Is there anything that we didn't touch on that you would want people to know?
Well, I think always whenever I'm talking to somebody about pelvic health, I always want to reiterate a couple of things that I think are maybe some common misconceptions just in general about pelvic health. And one of them is that it's normal to leak urine when you're pregnant or postpartum. It's not normal. Okay. It may be common, but it is absolutely not normal. So don't go down the rabbit hole of being like, oh, well, my mom said she had kids and then she leaked forever. There's plenty of stuff we can do to stop that. And so I always encourage people to seek help. Don't just take it as like, oh, well, this is my life. I have to live with this now. That's not good enough. We need to be better. And we want you guys to be living like full, happy, leak-free lives. So that's the biggest thing there. And the other thing is people are always we get the really bad advice from a lot of like OBGYNs, particularly that, oh, well, just do a bunch of Kegels. Just do a bunch of Kegels, you'll be fine. And number one, they don't tell you how to do a Kegel. And so, a lot of people don't do them well, and that can be very problematic to do the wrong type of Kegel. But also that blanket statement is not good because there's plenty of people who have too tight of a pelvic floor, and doing a bunch of Kegels on a really tight pelvic floor is just going to make things more symptomatic, and is not helpful, especially during a pregnancy when we're trying to prepare for a vaginal birth. We need the pelvic floor to be able to relax and open. And doing a bunch of Kegels is potentially going to make it tighter, and that can be really counterintuitive. So please don't listen to the general blanket statement of just do Kegels because there's way more to it than that, and you could be doing more harm than good.
So don't just live with pain and suck it up or
Right,
leaking
right,
and go beyond just do Kegels or just
right,
don't do Kegels. Yeah. Okay.
right, exactly.
That's phenomenal. So I will link to your video for the belly lift and also to the APTA website so that folks can go look at that and your website, of course. And that's it, I guess, for this
Okay,
moment anyway. Yeah.
awesome. Thank you, Lori, and thank you for everyone who asked great questions.
Yeah. Thank you so much. I really, really appreciate this. I know this is a real pain point for a lot of people.
Yeah, yeah. I hear it literally on a daily basis, so I'm happy to share more info.
Thank you.